Big day. Wish me luck.
When did you have surgery with Dr. Nolanchek last? About a month ago? She's a non-smoker. Hypothyroid. She's a little bit difficult learning oxygen.
Oh.
Which
Okay.
was
Okay.
You did great. This is your secondary crystal. Are you having any pain?
Temperature. And then with Dr. Isler is going to talk to you tomorrow. Let you know. She's pretty sleepy right now, so you're not going to read it.
Okay, this is December 4th, 2019. I'm out of surgery now. My husband Anton picked me up at First Glance Medical Clinic. Right now the time is 12:29 on Wednesday, December the 4th, 2019. I got my breast implants explanted and I got a breast lift. The bump feels kind of still there. They say that I have this beautiful glow. I look really glowy and I feel happy. I don't feel heavy in the chest anymore. My voice still sounds a little crazy because of the anesthetic, because they put a tube down your throat. But overall, the experience was really good. The staff and everybody was amazing. The anesthesiologist sat with me before the surgery, asked me specific questions. He was really great. It went really well. Everything was super clean in there. Everybody was really nice. They put compression motorized boots on my legs to regulate the leg area for circulation, and that felt really nice. Once I got the anesthetic, I was pretty much out. I went and didn't remember anything, and it was like a beautiful dream. It felt so good. When I was sitting there and they woke me up, the nurse was very nice. She helped me out. She was great. I felt like 50 pounds was lifted off my chest. I felt like there wasn't anyone sitting on my chest anymore. And that was the huge thing I noticed right away too. How I felt, not feeling sick. I feel good. The only feeling I feel now is a little bit of soreness. They gave me T3. They gave me some fentanyl. I was like, oh, fentanyl, oh, great. But it helped. It helps with the pain. And I asked lots of questions, and they answered most of my questions really well. The doctor came and saw me at the end. His bedside manner was amazing. He was great, very considerate. But overall, the experience was very good, and I see and feel a huge difference already. Hello, everyone. I survived. I feel 150% better, like to an extent. A lot of the symptoms went away. I feel like a weight has been lifted off my shoulders and on my chest, my back. Wow. Sorry, we're driving and my husband's waiting for these people to go and they're taking a long time. Anyways, thank you to First Glance Medical Clinic and Aesthetics Medical. First Glance Aesthetics and Dr. Isler for doing such an amazing job today. And the nurses and the staff were really good. I feel a huge difference. The nurse said I was glowing. I have a different glow, a different look about myself. So hopefully this will help me get better in my journey from breast implant illness. And I hope to, there's a truck there, you know. So, okay. And I hope this will help everything that I'm going through right now. But anyways, I'll keep you updated. currently have my drains in. They drained them a couple of times already. But overall, I'm doing really great. Thank you so much again to everyone for your support. And my voice sounds crazy. I sound like I got a voice transplant. It's probably from the tube being put down my throat from the anesthetic, or from the anesthetic or breathing or something. Who knows, right? But I'm super groggy, and I'm going to go to sleep once I get home. Overall, it's been a really great experience. I'm looking forward to sharing video and photos that the surgeon took. He'll send them to my email, and hopefully you guys will be able to experience through my eyes and the doctor's eyes of what exactly happened today. All right, we'll see you later. Thank you for following, liking, and sharing my page. I appreciate your continued support and my continued support to help you guys out if you have any questions and you need support, to somebody to listen. Have a great day. We'll see you later. All right, so they gave me my implants in a plastic bag, like a garbage bag. This is biomedical waste, Stericycle, protecting people, reducing risks. So let's see what it looks like. So these are my breast implants. They really, for how much money I spent, they can't put it in a nice fancy container, I guess. I guess they can't put it in a fancy container. All right, so here's the unveiling. Let's take a look at what they look like. All right, so that's what the implants look like. They cleaned them up, which was really nice of them. I had 2 implants put in. Take a look. So this is the size of my implants. They were very large, very big. You can see that they were in fairly good condition, considering. But you can see what implant I had. You can see what kind of, what implant it was. It was the by Mentor. And it was, the code was 5433912, 600 cc's. It looks like it was in okay condition. There's a lot of air pockets. I don't think it's supposed to have any air pockets in it. I don't think. But so that's the one implant. I don't know which one was what. If it was left or right. If it's left or right. I don't even know if it was left or right. I don't know which one was which. So this is the other implant by Mentor. So there's 2 different codes on here. You can see there's this one, which was 5. Oops. I don't want you to see me. Oops. This is 564990 by Mentor, and then this one was oh goodness, sweetie, you can't be on the table. Cats, you're trying to show everyone the world your implants, what was in my body. So I had these implants by Mentor. This was the number on the implant. What was 5743912, 600 cc's, and then this one was 5649990. So you can see that, I guess they're in okay condition. I don't know. The shell seems really thin. They look totally different from what I remember getting implanted in me. But, wow. I just don't know what to say. So that's the implant. Wow. And that was what it was inside me. It's crazy. But anyways, these are the implants. There's the front. They cleaned them up pretty good. They're cleaned up pretty good. I might at a later time go into more detail. This shell seems like quite, it feels weird, like, yeah, I don't know. So interesting. Anyways, that's my implants, my implants from my body. You can see here my implants. Here's one. Maybe I can show you if I go like this. So you can see that I've gotten, I feel and look so weird. Like I feel so weird. Here's my drains there too. So weird. I feel so weird. So I'm a lot smaller in the chest now, which is fine with me. I don't care. I was very small, but that's okay. That's okay. So I had these implanted in my body. Can you believe it? So this is my video. This is my 12-year-old implants that were in my body. Crazy. Anyways, thank you for following my journey. Today is December 4th, 2019. At what time is it now? I don't even know what time it is. What time is it? 12:53. 12:53, December 4th. You can see the difference, how this is clear and this is cloudy. You can tell the difference in the shell is weakened by, it's not, and I think these ones are textured. Yeah, these ones are textured implants. These are the textured implants. But you can see the difference in the color. You can see the difference in the texture. You can see the difference. See the difference in the color? But these are 12-year-old implants. This is crazy. So anyways, thank you for watching my live video. Hopefully this will help you understand what's going on. I just kind of don't think it was great that they just gave it to me in a bag. It should have been in a container, considering all the money I spent. I spent a lot of money on this surgery, and so did people donated money, and they donated the money. So anyways, have a great day. Thanks for watching my video. Okay, so I'm going to show you this fun adventure of drains. So I have a drain on this side and a drain on that side. You can see I'm allergic to latex, and I even told them not to use anything latex related, and they end up using latex stuff. I don't know what was here that made me have such a reaction, but so I use a safety pin. I have these little really convenient, cute little pockets inside, which are really great. And I just keep them in the pockets. You can see here, I put my drain. My drain has filled up quite a bit here with the fluid. You can wear gloves. I wash my hands, so I'm not contaminating it or anything. But it's time to empty it out now. So I'm gonna empty this out into a little container, a sterile container, or you can use, you're welcome to use, you know, the little Dixie cups and then just throw them away, but it's just easier just to sterilize the thing. I'm gonna take the cap off. The cap always stays on, and then it'll inflate the drain, and then you'll empty the drain into the cup, so you can see all that blood and that. So I don't know if you can see it. So you really want to. They say not to milk the drains. I don't know what to. I don't know, but I don't know. So you want to empty the drains in there, and then you can take your little your wipe here, if you have alcohol, and just wipe the cap of alcohol. So I got alcohol there. So I clean that off with alcohol or alcohol wipes, whatever is going to be the easiest. And now you can see that it's empty and I don't have any more liquid inside. So you just squeeze it like this, so it's compressed, all the air's out, and then you can dry off the lid so that you know you're not contaminating it, and you want to make sure all the air's out. I had been seeing people doing this, which was milking. I don't think you have to milk it unless it's necessary, but if you put a little bit of alcohol on there, or the alcohol wipe, and you can drain out more drain. So like there's no blood clots or clotting in the drain. So not much came out. They told me not to drain it, not to milk it. So I'm not going to until I have any complications or problems, which I don't think I'm going to have, because it's been very good, consistent blood or plasma or anything like that. So you want to squeeze it out, and then you'll put the cap back inside like that. So you go like that. So you want to make sure all the air is out, most of it, compress it, and it'll work better, right? Because it's a vacuum system, and you just want to make sure that it's like really well, like it'll work better when it's compressed, right? Because you want to make sure all the air is out of there. So you really want to make sure that the air's out and it's well cleaned out and that. So you want to make sure that's clean, right? Excuse the way I look. I'm still really bloated just from everything. So really squeeze out the air, get all that air out like that, and then you seal up the cap again. So if you can see that, you want to make it as closed as you can to get all the air out so it works properly as a vacuum seal, and you want to get that all out of there. So I have my drain. This is the one drain that's on the side there. I'm not as bloated as I was before I had implants. This is actually the best I've looked in a long time. And then if you have a pocket, you want to make sure that the drain is able to drain into it. It's not like I have it here hanging, or you can have it, they say not to have it up, lower down is better, but I have my little pocket here, and then you have your safety pin, and you take your safety pin, be careful not to puncture your actual little drain, your little drain pump here, or your vacuum pump. It has no mechanics, it's all about the way that it's made, right? And then I take this safety pin and I just attach it to an area that I know it's great preparation sheet. So the average has been 30 milliliters each time. So when I was looking at it, I'll probably look back at it and you can see the numbers on there. They're on there. You just have to really look, right? So that was about, I think it was about 20. I have to look back at the video. Like, I've got to write this down, right? Because I got to keep track. If you don't keep track, it's going to be a problem. All right. Oh, I don't know. Maybe it's from the tube. Like, I don't think so. I'm really itchy, though. Like, it's itchy, itchy, itchy. All right. Here's the other tube. So I'm just going to detach that from the other one. And then you just want to make sure you close up your safety pin because you don't want to pierce it, right? But this is how much I have it now. Let's see here. It says, it's hard to read. Like, honestly, it's hard to read. This one is at 25, almost 50, I'm guessing. I don't know if you can see it. Almost at 50, I think. I think it's almost at 50. So that's 50 milliliters. And that last time I did this was, I don't even know, when did I do it last? 3:45 p.m. And it was 50 and 50. So that was like 100 milliliters, give or take. I think this is 25 or is it 50? Oh, I can't even see. It's terrible. So I think it's 25. Let's see when I take out the thing and to gauge it. Okay, so here's how much fluid. This is from 3:45 p.m. and now it's I don't even know what time it is. Oh my goodness, my brain is turning up with me. 7:38. So 7:38 from 3:45 p.m. to 7:48. So it's at, I think it's at 25. Doesn't even say. Shoot. 50. Yeah, 25. So 25 for both of them. So it's 50 milliliters of blood and plasma or whichever. And then you undo the drain. I'm really all over the place, and I'm just going to put it in my container. I don't recommend putting blood down the drain, probably in the toilet. Probably makes more sense to me, I'm guessing. But, so you can see how much I have there. And you really want to keep your blood contained, because it could be a lot of different things in there, right? And just really get all that out of there. Like that, right? Okay, and then you just take your alcohol swab, or whatever you're using. And this keeps the bacteria and stuff out of there. So you want to keep that clean, and you want to squeeze it really good. Squeeze all that blood out away from you, not in your face. So squeeze it away. So if anything else comes out, you just want to make sure you squeeze it out, get all the air out, and then close it up. So it's nice and tight, and there's hardly any air in there. And this is how that vacuum will work, right? And then it draws more of the blood, plasma, maybe the remaining liquids that are in where the surgery has been doing. So this helps you heal faster. Some people won't have drains, and some people will. It varies on what kind of surgery you have. So always make sure your drains are downwards. They say I've seen videos where people have them up here. Really, I don't know how people can drain out the fluids or the bloods or the plasma or whichever they're draining. How can they have it up that high? So these yoga jackets are great. I got this one from Lululemon a long time ago. And you want to make sure you put it in an area that you're not going to be touching or playing around with it, and it's going to drain out more properly, right? Like, you have to excuse how I look. I mean, I had 4 hours of surgery today, and my breasts, like, I mean, this is a cute little thing, and then I have my big Licenza pajamas. I look so funny, but that's okay. You know what? As long as you're comfortable, and then you can do up your jacket. I really let people know wearing a really comfortable jacket to surgery like this, and they can zip it up on you, and you don't have to worry about it. It's not bad. The drains are kind of concealed, and I still look a little bit fashionable. And then today, this was from today. This was where my IV was. So you can see they did a pretty good job today. So everything was pretty good. So overall, here's like all the blood, like the blood that, I don't know if you can see that. So you can see that quite a bit of blood was brought out of me. So that was about 50 milliliters, I think, there. But don't put this down your sink. Put it in the toilet like you would, go to pee or do a bowel movement or pee or urinating or whatever. And you want to make sure it goes down the toilet, not down your sink. I think it's just because it's not contaminated blood, but it's not good to put it in the system. You can put it with something that has water so that it can flush down better, right? All right, I hope this helped you out for patient instructions on the Jackson Pratt wound drain system. That's what I did. And it keeps track of all the hour you did your drainage, the volume chart, so you can keep track. The less liquid that comes into your drains, the faster you can get your drains out of your body, so your doctor can see you faster too. I'm going to see my doctor like later this month. I'm going to have the drains in for a while, but he says if it slows down and I don't have hardly anything coming out, then he can take them out earlier. So this is great. They give you great instructions, and there's some really good videos on YouTube too. But this is the company that deals with the drains. So it seems like a pretty good company, I guess. I don't know. I haven't had any problems with them. I'm not having an allergic reaction or anything. So it seems pretty good. So hopefully this helps you with getting an idea how to take care of your drains. And And it depends on the surgery. Drains will be different sizes. These ones are very small because I got the breast explant, explant surgery for my breast implant illness, and a breast lift, and I got the capsulation around it. So I technically had 3 different procedures done in one. So I had a lot of work done on my chest. I originally was a double D, originally a size A before AB tubular breast. So this has been quite. Cone was inside me. Isn't that crazy? I don't know. Good old mentor. What's to us? Good old Johnson & Johnson company. So I had all that surgery done, and I'm so glad these are out now. I'm so happy they're out now. Like, let me tell you, I'm so happy. I'm so happy. These are literally like 10 pounds. 10 pounds of having these on my chest for the last 12 years. And I'm so happy to have these out. I'm very blessed and glad I got them out in time. I mean, I've been sick for a really long time. Lots of side effects from these implants. Silicone, textured implants by Mentor. Holy Dinah. Today is December 4th, 2019. Probably coming up to 8 or 9 o'clock, probably 8 o'clock at night. And this was my day of my surgery, and I got them explanted. And again, thank you to everyone who likes my page, who follows, who message me, all these random strangers, like women from the support groups. They're not strangers, they're our community. So I appreciate everybody messaging me and saying, well, I'm a survivor now, I guess. I'm called a breast implant illness survivor. So I had over 60 different symptoms, and I'm so appreciative of the people that have supported me and who have donated money and have been with me in my journey. Thank you very much. I appreciate it. Excuse me how I look. This is like the day of after I have had surgery. So, I mean, I look a lot healthier. Like, whites in my eyes are really clear and white, and my skin is actually looking better, and I don't look sick. I don't look as tired. I'm more alert, and I'm like have a lot more energy. So it's been, I'm so happy and excited that I got this done, because I can live my life normal, like a normal, natural person can. And it's been really great. Thank you for everyone who's been there for me through this whole journey. It's been really hard. All right, have a great evening. I thought I'd share with you how to drain your drains. If you have any questions on how to drain the drain from your surgery, let me know. I think I'm doing it right because that's how they instructed me, and hopefully this will help you in future surgeries. If you're having any explant surgery coming up, or you're having drains, you're gonna have drains and you need to empty your drains, this is great. I don't see too many videos on people, like personal experiences. I've seen a couple on YouTube, but not very many. Hopefully mine helps you in your journey and helps you, instruct you on how to take care of your body better and get healed faster, and how to drain them properly and not cause any harm or infection to yourself. All right, have a great evening. Thank you, everyone.